I'm gonna start a primary infusion. I'm gonna check the order for normal saline, 0.9 sodium chloride, bag to be administered. I'm gonna check the MAR 3 times. I'm gonna do the patient's rights, 5 rights, to medication administration and make sure everything is good. This is already primed, however, I would obtain my bag, check the expiration date, get my tubing, and have my tubing ready. When I pull my tubing out, I would clamp my roller on the tubing, and then I would most likely hang it, apply my tubing to the bag. With the roller clamped, I would squeeze this and get about half in there, and then I would slowly release the roller and get all the air bubbles out of the tubing. Once I've done that, my lid just fell off, I would scrub the hub of the INT for 30 seconds, vigorously the inside and outside of the hub, and then I would take my cap off that just fell off and then make sure I didn't touch the end of this, and I would apply it to my IV, my INT. Once I have it in there, I would unclamp the roller and make sure that I have dripping in the tubing and that it's flushing into the IV. Once that is done, I realize that I have a medication, IV medication to administer for my patient. So I grab all my supplies that I need for that. Again, I do check my MAR 3 times, do my 5 rights of patient medication administration, and then I will get my stuff to do my IV push. If I pull it up in another room, I will make sure I label the syringe with the name of the drug, the date, the time, and my name, in case it gets set down for any reason. So I have my supplies here for the 1 milligram hydromorphine that I'm gonna give my patient. So I'm gonna clean this for 30 seconds with the alcohol swab. Obviously make sure that I have the right medication and that their expiration date is not expired. Again, like I said, check my MAR, make sure everything is okay, check allergies, make sure it coincides with IV fluids that they're getting or any other medications they're getting, and that they have no allergies to the medication. I would also check vital signs prior to giving the medication, and that would be another thing that I would keep my eye on after medication administration. So I'm gonna get my needle to draw out my med. I'm gonna put 1 ml of air into the syringe, and then I'm going to inject that into my medication, and then I'm going to pull up my 1 ml making sure there's no bubbles in my syringe. Once I got my medication, I'm going to put the safety on. I'm going to come over to my patient. I'm going to make sure I clean this hub and the inside vigorously for 30 seconds. I'm gonna check the MAR for how long the medication needs to be pushed into the IV. And for this medication, it's 1 minute, over 1 minute. So we're gonna do a slow push. I'm gonna take my needle off while holding my hub And I am going to screw it on here. And then I'm going to administer this over 1 minute. So I'm going to slowly push. If I did not have IV fluids running, I would make sure that I flushed the INT prior to giving the medication. Still checking my time, make sure I'm slowly administering this according to the order. It's been about 1 minute. I'm gonna release this, and then I'm gonna flush for the same amount of time that I administered my medication. So I'll administer over 1 minute. Also, I would make sure there was no air bubbles in my flush prior to attaching it. I'll slowly administer at the same rate so the medication goes in slowly. It gets through that tubing slowly. Continuing to push over the minute. And that's been about 1 minute. I'd make sure I throw all my sharps in the sharps container. Syringes go per policy of the facility that you're at, where you would throw away medication, syringes, and saline. And that's how you do an IV push medication. Next, I'm gonna hang secondary tubing, a piggyback IV line. So I'm just gonna move my products here off to the side and gather my supplies. So again, I have medication. I'm going to make sure that I read the MAR, check the MAR 3 times, do the 5 patients' rights, make sure that there's no allergies to this medication or contraindications with the meds that are already running. And I will check the expiration date, and everything looks good. So here's my medication, IV medication. It's 100 ml. And I have my clamp here. So I'm gonna open my secondary tubing. Take the paper off the tubing. I will make sure that the clamp it's clamped down so that no fluid will run through, because you don't want to waste any medication since you're trying to give the ordered amount medication, and usually you want to give the whole bag. This is 100 ml, so we want to make sure the patient gets a full 100 mLs. So I'm clamped, and I have my medication. I'm going to take the tube off, the button off, and then I'm going to make sure I get it in there, making sure that I don't touch the end of the line tubing. And since we have that clamped, we're not gonna have any of the fluid come through. Just gonna set this here for, I will actually move my primary tubing down to so it's down lower. I'll set this here for a moment so that I can make sure I clean the hub that we're gonna use. So we wanna use this upper hub for a secondary piggyback. We're gonna clean it for 30 seconds. Make sure it's nice and clean. The hub around it and the inside. And then I'm going to take this off, attach, not touching the end, attach that to my primary tubing. And then we're gonna back prime it. So that means that we're gonna get saline from the original bag and prime it up into the secondary bag, about halfway. And then of course you wanna make sure that it's dripping. And then I'm going to hang it to gravity, so the smaller piggyback bag should be higher than the primary bagging. And once I have that hung, I will open it up and let that, make sure it's dripping and make sure that everything's connected to my patient and everything's flowing. Everything looks good. Again, I will let the patient know that if they have any burning, redness, pain, if they feel like anything is wrong with their IV site, just doesn't feel right, call us, let us know. If they feel like they're having allergic reactions, I will check vital signs. I will monitor the patient after the infusion of the medication starts. That's the same thing I would do for the IV medication. I would make sure they let us know if there's any redness, swelling, any pain, and then I would also monitor vital signs, especially according to whatever medication is given. Some can make the vital signs change drastically, and you don't want that to happen. And that's all.